On this episode of the Ask Mike Reinold Show, we're talking about educating physicians, educating patients, and educating sport coaches. Lots of education going on. The Ask Mike Reinold Show. Helping people feel better, move better, and perform better. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. I'm up here in Boston, Massachusetts at Champion PT and Performance with, our large crew. We got a couple of new students for this episode. Is this your first one, Logan?
Yes.
This is, good. So we got a couple of new students here to ask us some questions. That's going to be awesome. Heck, I think we have some formal announcements today, right? Like,
I'm pregnant.
Does Lenny LennyMacrina.com exist?
It may exist. It may have been launched
Slow
at
clap.
some point in this decade when you're watching this.
Is there still a plant as the cover?
There's no plant. There is a video of me.
Yeah,
Go to LennyMacrina.com and check it out.
So LennyMacrina.com is now live, and Lenny's going to be writing some awesome articles on there. Len, what's your thing? Why does it exist?
My thing is to kind of interpret the literature. Is to simplify physical therapy. I think we get too complicated out there, and so I feel like my role in this blog is to help simplify things and kind of cut through some of the BS in the literature and some of the BS that's out there in social media, and kind of bring things back to kind of middle of the road.
Nice. Like that. He's going to make physical therapy great. Anyway.
Right.
Dave Tilley, ShiftMovementScience.com. He's been shifting away on that for years.
Shift.
So you guys know that. So Dan Pope, fitness pain-free. His fitness has been pain-free for years. You guys know that. But Mike Scaduto, do you have an announcement too?
I also launched a website. It's MikeScaduto.com.
How do you spell Scaduto?
SCADUTO.
So MikeScaduto.com. And what's your thing?
My thing is trying to educate golfers specifically on how to move better and perform better, like that. But also just give them an outlet and a way to learn about how their body moves in the golf swing and what specific things we're looking for, and then how to progress their performance-based program and get a little bit stronger out in the gym safely and how that translates to their golf swing.
Nice.
Kind of my thing.
He's been working on his elevator pitch. That was solid. That was perfect.
And just hit the ball further.
Yeah.
Right. Yeah, exactly.
15 more yards.
Just like everything else. Like, we want injury-free golfing. Nobody wants to buy that. They all want to buy 15 more yards on your drive. But Mike's obviously passionate about golf, so he's gonna start producing some great content on there. He's already got a few things up there, but it's gonna be awesome. So anyway, student-wise, we're not even gonna have any questions.
Mike launched his new blog, MikeReinold.com.
We got a couple of new students. So Logan Klon. We don't even have nicknames.
Genghis Khan.
Maybe
There's so many obvious nicknames that we don't know which one
I know
to choose.
Logan's he's almost like a nickname factory right now. Like, we literally have had 20 that we can't. But Logan's just such a cool name in and of itself. We've just been calling him Logan.
It's like Wolverine, man. It's the best one ever.
Super lame, but
Epic movie.
Logan Klon. He's from Wash U in St. Louis. They have a great program there, so he's been kicking some butt. Right, we're doing pretty good. Zach Talley from Regis.
Yep.
Is this a university or a college?
University.
This is what we had with Keisha.
Shout out
It's a
Keisha.
university, so yeah, shout out to Keisha. But Zach is here. What's Zach's nickname?
Zach Tack.
Tally Ho? Zach
We
Tally
thought he
Ho.
was like Eli Manning, so we like Eli for a little while.
We called him
but-
Eli in there.
He's from,
he is
he's
Eli.
definitely a Manning.
From Billy Madison.
He's
He's the long lost Manning brother.
all right. Who's reading the questions today?
Moving on.
All right, Logan's up. I don't know where to go. I'm in the way. So Logan,
All right.
read him away. What do we got for question number one?
Hunter from California. I'm just starting to work with patients from a group of ortho surgeons. They do rehab like it's 1995. We can't see them until 2 to 4 weeks post-op for knees and 4 to 6 for shoulders. How could we go about introducing them to current practices, like seeing them the first week after surgery?
All right, so his surgeons, this is a he, I forget the name. Hunter, so probably he. So Hunter's surgeons are doing rehab like it's 1995, which sounds awesome to me. So Dave was an infant at that time.
I was a whopping 5.
He was 5 years old. So it sounds like to me they're rocking to maybe Pearl Jam's Vitalogy album, I think came out in 1995. Rage Against the Machine, I think, produced their second LP. That was a fantastic
Tupac.
one in '95.
Tupac was live then.
What else?
Big
Melancholy and the Infinite Sadness by the
Sounds like an uplifting one.
Smashing Pumpkins.
Infinite Sadness.
All right, this is the worst episode ever so far. All right, so rehab. So it's like 1995. Len, how do you talk to a surgeon? Let Lenny do this one, right? Because he's kind of the dry sense of humor, what we say in New England here. How do you talk to a surgeon and say, hey, your rehab is like 1995, which I think is a compliment, but anyway.
This is tricky. Sounds like they've been doing this for a while, so this is an uphill battle that you're probably not gonna win very quickly. You got to somehow get in a situation of where they trust you. You got to slowly break down their barrier. You got to get them in a neutral zone, meaning maybe you're at the company Christmas party or something. You're in a situation where it's not like you go up to them and say, hey, I think we need to progress this rehab. Like it's not. You're not going to do that. They're going to laugh at you. They don't care. They just want their patient to get better because they've been doing it like this for 20 years. So you got to somehow slowly chisel away. Maybe you're speaking at one of their meetings. You're hanging out with them on a Friday after work, and you get a beer or something like that. There's got to be a social atmosphere where you can kind of just hit them in a laid back position and just kind of throw some random stuff at them. Nothing earth shattering. They know the stuff. They just don't believe that they want to apply that to their people right now because it's already worked. I don't know if you guys have anything different to add, or
I think the barrier that exists a lot of times is that surgeons send their patients to several therapists.
That too.
And they have to have a baseline that they feel is comfortable.
Right.
We've talked to tons of surgeons that we've gone up to and said, hey, Dr. X and X, your protocol is a little conservative. We usually do this. What do you think? And they're like, oh, no. Well, you guys do whatever you want. That's just like what we do for the people we don't trust.
Yeah.
So I think what that means is you have to establish a layer of trust with your physicians and can't be a generic therapist that they work with. And Lenny, I think, nailed that, though. How do you do that? You try to, I think you have to get on their level. Like, we try to speak at meetings that our physicians are at. Like, I'm at a big meeting in Boston in a couple of weeks with all the local the local Boston docs, right? And they see me in a different light after they see me on the podium with them. Right, so now they're like, oh, all right. Well, if Mike does it this way, then that sounds like I'm more comfortable. So maybe you don't do that, but maybe, like Lenny said, there's social things that I think trust. You have to build trust, and then I bet you that they'll give you a little more leeway. Dan, you've been in a diverse background in Colorado and stuff with other docs. How did you guys do it?
Well, that was it, and I guess I've done this, and I'm starting to do this right now because I've only been here for like about 10 months or so. But I just came back from an appointment with one of my patients and just talked to the doctor. And you're building trust. Call them up, send them emails, ask them questions, send them patients, they send patients back. They actually ask you questions after a while as far as rehab goes, what do you think we should do? And then they have much more trust, and you can just say like, hey, can we start at this point for these? I think we're gonna have more progress based on these reasons. And it's building that trust. Just like you said, half the doctors I called when I first established myself in the area were like, oh yeah, it's just generic protocol. I have no idea where that came from.
I guarantee the docs don't even realize what's on their protocol, or they're like, oh yeah, really? No, you can do that. There's definitely, they haven't looked at those protocols in a long time, or their nurse or whoever is giving out the protocols doesn't even realize what's on them, I guarantee. And they would probably want them updated. It's just, you got to figure out a way to break down that little wall.
Win them over with trust.
Yeah.
Don't go in there guns blazing, like saying that they're doing it wrong, right? You got to win them over with trust. I think that's the big one. So this is the education episode, by the way. So that's educating physicians.
Oh boy.
What's next, Logan? We're switching.
We're switching.
Sorry. What's
Tally ho!
What's up, Tally ho?
Tally ho!
Yeah, that's like a call. That's like a call to action here on the podcast.
Tally ho!
Tally ho! Wait, where do we emphasize? Do we emphasize the ho or the tally?
I would emphasize the tally on the podcast.
Tally ho! No,
Tally ho!
we're spiking the audio, I bet. Anyway, all right, tally ho, what do we got?
All right, Jarrett from Massachusetts. Guys, love the show. Lenny does a great job sharing publications concerning outcomes following surgery.
I have a blog post now too. You can go to that.
How do you balance giving your patients this evidence-based information on the risks of re-injury following surgery without creating movement fear and anxiety during their return to sport?
All right,
I scare the crap out of my people.
That thing's gonna rip. That thing's gonna rip.
Back until 2 years after an ACL.
Let's approach this as how do you educate your patients with current science, right?
Yeah,
And like, how do you integrate it? How do you? I think the question is what's too much? Let's
Right.
not focus exactly
Yeah.
because trust me, none of our whatever. I don't want to get into.
There's
that
some people
fear
that I
thing.
think I need to get a little bit more in depth. I have everything in my head. I'm guiding it the way I think is best based off of my experience in literature. But there's some people that are going to push to the point where you need to let them know the true numbers. I had a guy the other day, ACL. He's like 4 months out, and he is dying to do crazy stuff that I don't think he's ready for. And I had to throw you get a 25% chance of re-tearing your ACL. I don't want to throw that at my ACLs. That'll freak him out. But he needed to know that if he tries to go too quickly, he's risking, OA long term. He's risking re-tearing his ACL. So it's in my head, and it's definitely individualized based off of the person's education, their level of interest, how they are responding to PT. There's so many different variables that it's tough for me to just say I do this for everybody. So it's so individualized.
So Dave, you work with a lot of young athletes. I think that changes a little bit. What's your strategy with young athletes?
Yeah, I think that it's there's a fine line between having the most current kind of evidence in your mind guiding your suggestions and your like what you think the best course of action is. But like Lenny said, it's not like dumping terminology on them or like going way too over their head with like the actual jargon of the medical literature. So it's like, a lot of studies showed this, and so seeing a lot of back fractures late, it's like, well, we know about like 4 to 6 months for it to heal, and then maybe up to 9 months for you to get back, and like here are the possible things that could go wrong if you go back too soon. You could have some things here and there, and I think that they understand that. But for an athlete that's in high school, and especially with a mom who's doesn't really know what's going on and they're equally as kind of worried about it, it's like you have to kind of just be like, well, this is our best approach and we're going to try these things, but know that it's not a linear approach, that we might have some bumps along the road. And I think the jargon you use is very important the younger the athlete is.
So Mike, sorry, Dan, you got something?
I do, but we'll go Mike first.
But Mike, as a recent graduate, so a younger physical therapist in your career, how are you working towards that? How are your conversations with clients going? Because I know that's a thing you learn. Like you learn how to talk. Like, have you had any experiences where you've gone over someone's head or something like that? Like, how's it going?
Definitely had an experience where I find myself throwing all these technical terms at people, and I don't think they're really understanding what I'm saying, and they're not taking that home and not taking that message with them when they leave. So I found I had to take a step back, try and speak on their level, but also be very upfront about what I think their course of rehab is going to be and what they need while they're in here and what their plan is going forward. I think kind of laying that out early on, that's something you guys have really helped me work on and taught me, is to be very upfront and kind of lay out that whole plan as best you can. And anticipating some bumps and bruises along the way is something that I'm working on continuously. I think it gets better over time, but it's definitely something that's important.
Yeah,
as a young therapist.
it's like you got to find your way.
Yeah.
You berate somebody with too much science, and then you realize, oh, that probably didn't go as well as I thought it was going
Our
to
place is
do.
so small too. We can hear everything he says. So if we hear something, we're like,
Oh, we're analyzing the crap out
Makes
of
me
it.
a little nervous.
Just walking on eggshells every day. Dan, what do you got?
All right, I'm going to say that it really depends completely on the patient population, right? General outpatient setting. So when I was in Colorado, we saw combination of some athletes, and we also saw some geriatrics and people with chronic pain. For the person where you're battling for them to actually move a little bit, right, and to actually start exercising some, I think a lot of times you're really trying to educate that person. Like, motion is good. We want to get you going, and we don't want to make them fearful of motion because you're doing whatever you can in your power to get them moving. For a lot of our athletes, they're doing way too much, and you got to back them off a little bit. Sometimes we get people post-surgical, they're doing pull-ups week 2 and crazy stuff. And you're like, don't do this. This is bad. I think sometimes giving them that negative is a good thing.
Yeah,
I think sometimes you go too far.
Yeah,
That's a good point. So sometimes I think fear's a negative word here. Sometimes you're intentionally kind of trying to get them hey, this isn't all, this isn't all roses here. Sometimes there's some negatives.
You got to read the crowd.
Yeah, makes sense. Genghis. What do we got, Genghis?
I'm going to go with Morgan Freeman because you sound like Morgan Freeman narrating something right now.
All right. Mary Kate from New Jersey. Hi, Mike and the gang. Love the show.
Gang.
I coach softball and just graduated PT school. A well-known pitching coach in my area tells the girls not to strengthen their upper body because it will affect their pitching mechanics. How do we educate them on the importance of strength training in the prevention of injury?
I like it. So we have educating physicians, educating patients. Now we have educating, we'll say coaches, like a sport coach. So Dave, we can just let Dave handle this one. But how do you educate the old school coaches to be more modern. I
Yeah.
don't know if that's the way of saying it, but
This has been constantly is to like one of my biggest challenges I face kind of in my position because I still coach gymnastics, and I would say half my interactions are teaching coaches about why things are happening and why people are getting hurt and like what the new science promotes over what kind of has been around in our sport for years. And I think that the first error that I made was really just like I don't say attacking is the word, but just like just dumping it all on someone, and instantly they feel like you're attacking them and you're like, well, what, you don't know anything or something like that. As soon as you do that, somebody shuts down, they will never listen to you again. So I think that the hardest thing to do, but the most important, is to like very kind of like delicately touch upon certain subjects. Like, hey, well, there's some new ideas out there, and like, what do you think? And like kind of have a conversation more than just like an onslaught on them. And I think too is that if you talk about performance and injury in the same parallel track, people are much more on board from the performance side. You know what I mean? So like I used to always talk about, well, we don't want to have ACL tears and hurt people's backs, and as much as I wish they would listen, it was really hard to get that. But I was like, okay, well, if we clear up all these movement issues and we get you a little stronger, actually you might run a little faster, you might jump a little higher, and people are like, oh, okay. But in the back of my mind, and you won't fracture your back. But like kind of going on that, what they're the most interested in is maybe the first best route, and then just kind of like the before trust, slowly sprinkling it in.
trust is one, and then I hate to say it, I think it's marketing.
Yeah.
It's just a different sense of marketing. So you have to go to their desires. What do they want?
Exactly.
They want performance out of their athletes. So show them how it's performance, and then we'll say like wink wink, they're actually reducing injuries too. But like again, nobody wants to buy an injury prevention program. Like people want a performance enhancement program.
Mm-hmm.
So awesome, tons of education on this episode. I love it. If you like more education, head to MikeReinold.com, click on that podcast link, and keep asking us questions. Great questions come in. Again, we love them all. Go to iTunes, rate, review, subscribe, and I guess we'll see you on the next episode. I don't have like a better conclusion than that. So, LennyMcCrino.com, MikeScuduto.com. Thanks.